As cases in the state continue to surge, the health director said the growing positivity rate should be looked at in context. Thanks for joining us tonight. I'm Lucas Geisler. Deborah has the night off. ABC 17's Connor Hirsch is live at the state capitol tonight after looking at the rate in the state. Connor, it's nearing 10%, which Dr. Randall Williams previously told you it would be concerning.
Lucas, I asked Dr. Randall Williams at the beginning of the reopening process here in the state of Missouri at what point he would start to get concerned about a rise in cases. And he gave me two numbers, 5% and 10% positivity rate. The 5% is something they wanted to shoot for being below, but 10% is what they don't want to be above.
It is important to understand that the daily numbers represent a wide variation. This is why we continue to focus on the 7-day positivity rate, which is at 8.8 for the week of July the 10th through July the 16th.
I asked Dr. Williams if that number approaching what he previously told me was a warning sign is concerning him. He pointed to the growing cases in the younger population, saying the state factors in who is getting infected.
So when we look at that 10%, it would be very much on our mind what that population is. So if that was a 10% of 20-year-olds, then we would have a much different look at that than if it was 70-year-olds.
The data continues to show a spike in cases in the younger population, with about 9,300 cases in the 20 to 30-year-old population.
They need to use hand washing. They need to social distance. It just doesn't come natural to them. And they need to wear face masks if they can't do the other.
As the positivity rate is rising, the state also keeps an eye on the hospitalization rates, which Williams said are going up, but not as quick as it was earlier during the pandemic. He believes that's because the younger demographic is being infected.
It's not like when we get to 10.1, that's an automatic trigger because of the other factors I mentioned. We look at it holistically.
And Dr. Williams said the department is getting close to entering that backlog of tests that we've been reporting on as a factor of the increases in positive cases that we've seen. He said they have about 6,000 left, and they think that they will be able to enter those all in by Friday. Reporting live in Jefferson City, Connor Hirsch, ABC 17 News.
Thank you, Connor. Both Dr. Williams and Governor Parson stressed the importance of contact tracing today, saying the health department is working to train more contact tracers to support local levels.